So today the main topic that we have picked is colic in equines. I'm going to jump right in and ask you firstly, what do you mean by colic? How do you define colic?
Yes, colic means any sort of abdominal pain. In horses
Okay.
is called as colic. Not only in horses, even in humans, you can use that term. For
Yes.
babies, we normally use this term.
Yes.
Babies getting colic. So any sort of abdominal pain
Uh-huh.
is called like colic.
Right. Now, what are the different types of colic?
There are various types of colics, starting from displacemental colics of the large colon. Uh,
Mhm.
if the small intestine is involved, there are volvuluses, intersusceptions. Volvulus is
Mhm.
basically meaning the
Mhm.
twist of the intestine,
Yes.
variable degrees.
Right.
It be a one knot, which is of 360 degrees to two knots, or just a partial twisting. It could be
Right.
anything.
Right.
Uh, there are colics called as impaction colics of varying degrees with feed or some other materials.
Okay.
Um, there are some called displacement colics, which are associated with the spaces. One is called as nephrosplenic entrapment. It is basically a space between abdominal wall and the spleen. So what happens is the large colon or a small intestine shifts itself in between the abdominal wall and the spleen itself, which is not a normal position for the intestine to have, and
Right.
they into kind of pain.
Right.
There is one very low occurring colic which I
Mm.
want to mention you, because I have seen one
Right.
in my due course of practice,
Yes.
which is called as epiploic foramen entrapment colics.
Okay.
So these colics are very painful, first of all,
Okay.
and very difficult to diagnose, because what happens is the epiploic foramina is very proximally in the body of the horse, close
Mm-hmm.
to close to the diaphragm. And the epiploic foramina is basically a space between the lever lobes, wherein a lot of blood vessels, major blood vessels are running. So
Mm-hmm.
into that small space, somehow the small intestine passes through,
Right.
and the horses get very, very painful. So this is one colic which occurs very rarely, but yes, again, this is one type of colic. There are colics which happens because of excessive loading of the worms in the intestines,
Right.
causing the lumen blockage and all.
Mm-hmm.
Uh, they are kind of colics. I will not say a true colic happening because of the gastric ulcers also.
Mm-hmm.
So there are lots and lots of colics, if you go by
Go to
the factors associated with it, or the structural damage associated with the gastrointestinal tract,
right.
as we can call them.
So, are there different colics which affect, say, race horses as opposed to show jumpers or endurance horses? Are there different things which they're more predisposed to?
Um, there is no clear-cut distinction between what I have experienced with
Uh-huh.
my practice.
Mm-hmm.
Uh, but I can name you the few, like in thoroughbred. In my
Mm-hmm.
previous practice, we used to have a lot of small intestinal volvuluses,
Right.
and we used to open.
Mm-hmm.
Um, as compared to different geographical location out here,
Yeah.
with a lot of impaction colics, maybe because of the weather we are living in.
Mm-hmm.
Uh, Maybe some sort of food, but I think that's a minimal chance of the food involvement with that. And maybe because of the kind of
Mm-hmm.
breeding they are put into.
Mm-hmm.
Uh, so yeah,
Mm-hmm.
again, I have some experience with show jumpers and all, because my friends used to have show jumper horses.
Mm-hmm.
Uh, with them, we used to have large colon displacement cases,
Right.
but those kind of cases we get out here as well.
Right.
So there will not be a clear-cut demarcation that those horses get it and these horses don't get it.
Right. Right.
But yes, small and large colon cases were pretty common in flat race horses,
Mm-hmm.
as compared to impactions, wherein invariably we get more percentage of impactions, different impactions out here.
Mm-hmm.
Uh, than you say volvuluses of the small intestine. Basically, we do get, but the
Mm.
percentage is low comparatively.
Makes sense. Makes sense. And what is the what is the key factor? Would you say high stress environment for sport horses and intensive training environments contribute to colic episodes? Is that the main cause?
It could be to some extent because what happens is, I'll tell you, uh, with the stress, the bodily functions disrupt, the gastrointestinal functions disrupt. So what that in turn will cause is, with increased stress, horses can get gastric ulcers.
Right.
Um, Ulcers can be bleeding and all, and they can cause a lot of abdominal pain, discomfort, leading to
Mhm.
colic.
Mhm. Yes.
Again, horses, when they get into stress, they leave their food and water.
Okay.
Uh,
Yes.
when horses leave food, again the gastric motility will get disturbed because you need a food in the tract for to have a nice motility,
Yes.
for a healthy gut to have.
Yes.
So again, in turn, that can slowly lead to the colics.
Uh-huh.
Uh, Less water consumption will have dehydration,
Right.
which in turn can cause impaction colic, because impaction colics normally are caused because of dehydration and less water intake
Right.
by the horse. You
Mhm.
know, feed material gets very dry and rough,
Mm.
and slowly the intestine, GIT tract loses the motility because of the dryness of
Right.
the material in it.
Right. Right.
Um, some of it can be caused because of the immunosuppression, because of the stress.
Mm.
The horses get into kind of immunosuppression,
Mm.
and they get into various secondary problems like inflammation, infection, and all those sort of stuff. And secondary to that, also sometimes colics can happen because the system is kind of compromised.
Okay.
It is kind of an option.
Mhm.
um, Changes in the feed all of a sudden
Mm.
can contributing factor,
Mhm.
because anything which is sudden in horses doesn't sit well with them.
Uh,
That
th-
is
uh,
also that is also one of the reason.
could you explain a little bit more about between, the relationship between this feeding schedule, diet changes, and then how that results in colic for eventually could result in colic when it comes to these horses.
See, feeding schedule is very important, especially in cases of racing horses, because they are athletic horses. So they need to get a desired amount of whatever the is deciding is good for them.
Yeah.
Balanced feed at the right time
Hmm.
and in the right intervals
Right.
throughout, whether it is 3 meals, 4 meals, 2 meals. When I say a balanced diet, it should have right amount of proteins, fats, and a very good amount of fiber content, because that is very important uh, to have a healthy gastric motility, and in turn
Mm.
maintaining a gastric health.
Mm.
So, a lot of fibers are playing very important role in the healthy gastrointestinal tract.
Right.
Uh, so if you maintain that, like if you manage it well, if you maintain that well, there are chances of getting a reduced amount of colics. First of all, uh, if you say about this was about the feeding schedule.
Yes.
If you say about what is the second thing you said? Feeding
Feeding
schedule.
schedule and the actual nutrition, the nutrition itself. If
Okay.
you notice the nutrition.
Yes, dietary changes. As I mentioned earlier, if we have a balanced diet,
Yeah.
that also reduces the risk of
Yes.
colic, because we are having good amount of hay, grass, forages, like basically roughages in their feed. So
Yeah.
that is maintaining the gastric motility. Again, it maintains the healthy bacteria in the gut,
Right.
which in turn causes fermentation in the cecum,
Yeah.
and maintains the gastric gastrointestinal environment well. So
Right.
that fits well with maintaining the healthy gastrointestinal tract.
What about
Um,
electrolytes and dehydration from lack of water and just not drinking enough water? Does that affect horses sweating, for example? Does that affect?
yes, yes, yes,
Are,
yes,
are there
very much. Water plays
correlation?
a very important role as far as the colic is concerned. Basically,
Right.
what the horses get with water deprivation is dehydration, which can result into impaction colics, which could be of various grades
Right.
and of various factors like
Mhm.
feed material impaction,
Right.
sometimes sand impactions, which
Uh,
are again related to geographical areas.
yeah. Yep.
I can explain it later. Uh, there are basically five electrolytes which are important for the horses
Right.
and can go abnormal in this kind of cases.
Mhm.
The most important are potassium and magnesium.
Mhm.
The other ones are calcium, sodium, and chloride.
Right.
But after these four, the low levels of potassium, magnesium, calcium, and
Mm.
sodium can cause most of the abnormalities in most of the cases.
Okay.
An increased level of chloride can cause the abnormalities. So if we go by the abnormality, in most of the cases it goes like that. Low
Okay.
levels of four, potassium, sodium, calcium, and magnesium, and high levels of chloride. So the symptom of hypokalemia or hypomagnesemia are horses go weak, lethargic. They don't
Okay.
have appetite. With less calcium and magnesium, horses can get ventricular flutters.
Mm.
They get muscle twitching, tetany,
Mm.
uh, weaknesses in their general condition.
Mm.
Kind of symptoms we get because of the electrolytes imbalance.
Right.
Uh, it's not necessarily that we have to correct all the electrolytes imbalances
Okay.
in colics, to be precise. Um, if it is about hypokalemia, which is low potassium, it is
Mhm.
better to replenish it. And same goes with the magnesium as well.
Hmm.
And you can correct in case of hypokalemia, you can correct it with potassium chloride.
Right.
If potassium and chloride are less,
Hmm.
you can go with potassium carbonate, I guess, so
Yes.
that you don't get more levels of chloride, because if the chloride is high, you don't want again to increase the levels of chlorides.
Right.
And normally they are given potassium chlorides. Normally they are given in the fluid in a big bag
Hmm.
in a plate, so that you don't get anaphylactic reactions, because the horses are already depleted, they can react adversely.
Right.
So they are given into big bags mixed with these injections in a slow intervals, very
Right.
controlled injections. Same goes with the magnesium.
Uh-huh.
You can give magnesium sulfate, which can be
Mm.
given or IV. The problem with oral magnesium sulfate is the bioavailability in the body is less because of the absorption of the magnesium
Mm.
sulfate.
Mm. Mm.
And again, magnesium sulfate is used as a laxative in horses to
Oh,
produce the diarrhea as a laxation.
right.
So it doesn't sit well with our criteria of treatment
Mm.
in cases of in these kind of cases. So it is advisable to give IV solutions
IV
of that
solutions.
in the drip.
And again, it sounds like these decisions need to be done by in consultation with the vet rather than
Yeah.
somebody starting their own bright ideas.
No, no, of course, it has to be done by the vet by knowing the values of these electrolytes. Because
Mhm.
as I said, not all the electrolytes abnormalities need intervention, but
Right.
some does, like potassium,
Yes.
magnesium,
Yes.
at times calcium.
Mm.
So you need to know the levels of the electrolytes. You need
Mhm.
to test them. You
Mhm.
have to correlate the levels clinically with the horse.
Mm.
Not all the abnormal levels or low levels signify intervention from the vet.
Correct.
Sometimes, yes, you do have to intervene and go ahead with your treatment protocol. Um, in comparison to when sodium and chloride levels are low,
Mm.
you hardly need intervention by the vet, or you hardly need to treat it basically,
Yes.
because it gets corrected with your fluids or electrolytes what you give. The
Yep.
fluids what you run through the horses are
Yes.
basically sodium and chloride fluids. So
Yes.
they get corrected as it is. It doesn't need that much of intervention, to be very frank. If at all you need to correct even the sodium levels, you can do it with sodium carbonates, or if you need to correct both sodium and chloride, you can give sodium chloride solutions.
So,
So the point is
not
not that
necessary that.
abnormalities need intervention. You need to correlate the clinical sign of the horses, the blood value of the horses, and which um, correlation or which values uh, correlating with the clinical symptoms will need intervention. So for
Absolutely.
that you need a clinical expertise. You can't just go by a mere vague perception or figment of imagination, or just by the thought process that I will do this. It doesn't work that way. Sometimes these heroics can help the horse. I'm not saying no, but most of the time you can mess up the things and it can go in the wrong direction. It might lose
Exactly.
the horse as well.
Exactly. So it's
But
important
as
for
I
the
said,
doctor
uh,
to.
this potassium chloride and all these injections, they have to be given under supervision at the very slow rate, because they themselves can cause reaction in the horses. And as the horse is very dull and depressed and weak, so
Mm,
more prone to these kind of reactions when you are treating them as well. Even with the right amount of medications, you need to keep an eye
mhm.
on them. It applies to the horses anyways, because horses as it is sometimes can show some adverse reactions to the
Makes.
medications.
And what about where do you see that turning point between medical management and surgical intervention when you're treating colic, especially when you're dealing with very high value horses?
Yeah, this is a very good question. I basically like this thought process and question, because the racing industry is we can say the horses are high profile.
Yes.
uh, I will not say a product, but the performer
Yes.
here.
Yes.
So it is very important to differentiate between a medical grade colic and a surgical colic at some point of time
Yes.
after receiving the horse. So how I proceed with the colics basically is, when I see the horse, uh, I would like to have a clinical examination of the horse, the
Yeah.
dehydration, the membranes. I would like to know the history of the horse, how painful he was,
Hmm.
what before and all. Is there any change in the feed?
Hmm.
Basically, we know the environment where they are kept. I would like where he was kept, in
Hmm.
which area, the
Hmm.
barn, the AC barn, or the paddock, or whatever, just
Hmm.
to get an idea of the history. I
Hmm.
will look the horse how he is clinically.
Hmm.
Um, I will auscultate for checking heart rate, just to get the grade of pain. What is it? Is not a true idea,
Yeah.
but a tentative idea as to grade of the pain of the horse, just
Hmm.
by knowing heart rate.
Hmm.
Normal heart rate for the horse is 36.
Yes.
It's average.
Okay.
The performer can have heart rate as close as 24.
Okay.
Yeah. Some horses can have their average heart rate at 42 to 45.
Right.
Because
Okay.
if for humans that applies, everybody has a different set of heart rate.
Yeah.
But top athletes, normally for our horses, we consider 36 as a good average heart rate.
Average. Average.
So anything above 60 tells you that the horse is in stress, good stress amount,
Yeah.
good amount of stress.
Yeah. Yeah.
Uh, I check the motility, all the four quadrants of the abdomen, the
Uh-huh.
left flank, the right left lower flank, the right upper flank, the right lower flank,
Uh-huh.
just to get idea of the motility in which section
Yeah.
of the colon, what sort of motility is there, whether there is any gas that gives an idea of the
Yes.
gas and the motility, whether the horse is hypermotile, means there is less motility, or horse is completely non-motile, because there
Yes.
is no gut sound to
Hmm.
the horse. It gives you idea about the gas in which
Hmm.
quadrant of the colon or the cecum the gas is.
Hmm.
It's
Hmm.
just a broader idea. Uh, I do a rectal examination, which I feel is a very, very important tool,
Hmm.
or a set of examination which gives us a good idea as to what's happening with the horse.
Correct.
So you go, you do a rectal examination, check what do you really feel in there as to large colon distension and to
Mhm.
which side. That will
Mhm.
give whether it is gas in the cecum or there is gas in the colon. Uh,
Mhm.
you can check the position of the colon if it is
Mhm.
sitting in the pelvic cavity or in the abdominal cavity.
Right.
Sometimes in displacement cases with moderate to high distension, the
Mhm.
colon comes back from its normal position and sits into the pelvic cavity,
Right.
uh, than sitting into a normal abdominal cavity.
Mhm.
Uh, you can just sort of tap it and see the amount of gas or the amount of degree of impaction,
Right.
whether it's very dry, very hard. That gives you the grade of impaction also that the horse is impacted for a very long time, and
Mhm.
possibly it's going to take a long time to resolve as well.
Yes. Yes.
Uh, the texture of the impaction of the surface of the cecum or colon can also give you a broader idea as to it is a feed impaction
Mhm.
or a sand impaction,
Mhm.
because sand impaction kind of feels very plain, kind of smooth, because
Mhm.
sand is very fine. In
Mhm.
several cases, at least for us out
Yes.
here,
Okay.
as in feed or in grass impaction, which normally
Mhm.
does a grass impaction, but the concentrate feed or oat impaction or concentrate feed impaction does happens.
Yeah.
You feel little roughening, so you at least I just get an idea
Mm.
from what kind of impaction it is.
Mm.
Um, so plus in addition to that, I try to do abdominal ultrasounds
Right.
um, to get an idea as to what I see abdominally with the ultrasound to correlate with all these things.
Yes.
Because especially for the high value horses, you need to know how the colic is proceeding to your
Mhm.
treatment when the horse has came into your analgesics,
Yes.
um, to your fluid therapies, sometimes to your sedatives.
Yes.
So you do your ultrasounds to check for small intestinal loops, if at
Mhm.
all find them, how motile they are, how big they are, whether they are
Mhm.
completely non-motile.
Yeah.
If you can see the large colon distensions,
Mhm.
you see a large distension of the stomach,
Mm.
that there is a lot of fluid built up in the stomach
Right.
and coming backwards and giving a lot of pressure into the organs behind, including
Mhm.
colon and the small intestine
Mm.
as well. So these things gives you a basic idea as to how bad the colic is going on. In
Right.
addition to this, if the horse is very high value and owner or a trainer is still not willing to proceed with the surgery with correlating with the amount of pain the horse is showing,
Yeah.
what you can do is a peritoneal tap,
Mm.
basically done at the lower abdomen
Okay.
uh, by cleaning thoroughly with the sterile procedures and all.
Mhm.
Peritoneal tap is a non-blunt kind of a needle-like instrument which you have
Uh-huh.
to do with a small incision, very
Mm.
into the abdomen of the horse, and you
Mm.
get the peritoneal fluid of the horse to see. So normal peritoneal fluid of the horse is like a water,
Right.
just little bit more cloudier than the water.
Okay.
If you get it like yellowish,
Mm.
pale or yellowish,
Mm.
it means that the horse is slowly worsening.
Mm.
The
Right.
protein level is high. That is why, because of the increased protein levels, the
Mhm.
color of the peritoneal fluid is changing.
Right.
If you get a reddish brownish, it
Mm.
means that the protein levels are very very high. There is hemorrhage in the abdomen
Right.
because of the possible involvement of the tissue damage, whether it is small intestine or large colon.
Wow.
And it is high time that you have to open. You should have opened before,
Yeah.
but it is high time that you have to open.
Okay.
Otherwise, there is very likelihood that this progression of the damaged intestine will proceed into death of the horse
Right.
finally.
So
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 when
there are
you
clear stages which you are able to identify when you need to open up. You need to get into surgical procedure.
yeah, exactly, at times when the horse is very very painful and you
Mm.
have backup of ultrasound findings and rectal findings.
Uh-huh. Uh,
Uh, we try to proceed. We try to proceed with the surgery because the horse is high value and the pain is making sense. You are already palpating the volvulus of the horse. In
Yes.
a rectal examination, you have non-motile
Yeah.
intestinal loops of 4 5 centimeter on the ultrasound scan, and
Mm.
nothing is helping. Whatever treatment
Yeah.
you are doing medically is not helping.
Yeah.
So it
Yeah.
does make sense to open up the horse, because otherwise, as longer you take to open the horse, the prognosis of the surgery is bad.
Less
Survival is less.
favorable. Yeah. Favorability goes
Chances of
down.
post-operative complications increase more.
Right.
There is more cost involved in it. So
Uh,
everything goes in a negative direction if you wait for a longer time.
let's look at the opposite side. Could you talk about few points where a trainer or a rider, somebody will identify colic, that the horse is in pain? I mean, I'm assuming the horse doesn't start jumping up and down and screaming if he's in pain. There will be some other signs.
Yeah,
How do
unfortunately, they
you initially identify that, okay, there is maybe something wrong, maybe we need to call in a vet?
yes, of course. Basically, for horsemen, in a sense, people who are close to the horses on a daily in a daily life, if he looks anything which is looking not normal for that particular horse,
Hmm.
is a red flag.
Okay.
First thing. Then you have to look horses when they are in pain. They paw from the front legs
Okay.
in the bedding and all.
Okay.
They try to look on the sides
Okay.
where they are feeling more pain, right?
Okay.
Maybe on the right, on the left, or on the left,
Okay.
because they are feeling more pain on that side.
Yeah.
They have kind of patchy sweating in kind of structural involvement, like kind of
Hmm.
displacement
Hmm.
of the small intestine or a large colon.
Right.
Plus, they show violent pain reactions by rolling over on the ground or on the bedding because the
Okay.
pain is too much for them to bear.
Okay.
Some of the horses who are having displacements and all, they try to stretch their abdomen. By doing that, they feel little less pain. So they try to do that by
Yeah.
stretching their abdomen.
Right. Right.
Some horses go in the backward recumbency, like dorsal recumbency on the back, and they violently move or shake their legs in the air, exhibiting the symptoms of more pain.
Right. Right.
So these symptoms, you get an idea that there's something wrong with the horse. Some
Right.
of the horses are showing silent symptoms as to they just sit down and get up. Some
Okay.
of the horses just stop eating and they just sit quietly without
Hmm.
exhibiting any symptoms.
Hmm.
So you need to know which horse shows what kind of symptoms. Not every small symptom means a colic. But
Correct.
if you have service of the vet or something, it is better to check. Uh,
Hmm.
and just make sure that the horse is not colicky. Uh,
End of the day, very valuable animal, very loved animal. Better check with the vet if there is anything before you get into very big distress signals.
yeah, of course.
Have
If
a
you have a service or if somebody has a service, better they should check it out in this kind of with this kind of symptoms at the earliest, so that the prognosis is good. They resolve very, I mean, profoundly faster, and less headache, less treatment involvement, less money is involved as far as the finances as are concerned.
concern. Yeah. What about the specific conditions which affect the horses here? When we're talking about the Middle East, the GCC, we know we have extreme temperatures. We sand impact was one thing that you were talking about earlier. What are the specific concerns which could maybe bring about colic, or have and what is the treatment approaches that you are used to seeing?
Okay, for this geographical location,
Mhm.
first we are at certain months of the year we are dealing with very high temperature.
Yes, absolutely.
So that in turn causes dehydration.
Right.
Uh, uh, and if the horses are drinking less, that even cascades the, the chain reaction faster,
Yeah, yeah, yeah.
causing impactions of the large
Yes,
colon or
yes.
maybe small intestines,
Right.
whether it is of feed material.
Yeah.
Uh, and then you have to treat it accordingly,
Yeah.
by finding out or diagnosing the impaction
Yes.
with
Yes.
either mineral oils, like
Uh,
paraffin mineral oil, you have to
uh,
give by the tube.
okay.
And you have to check for the manure output
Uh,
every 12 hours. And you have to again redo the rectals probably 24 hours if the impaction was very bad,
wow.
just to check how much it is resolved.
Right. Yes.
Uh,
Okay.
and you have to keep on checking the manure, how much the horse is just passing on,
Uh,
just to correlate the things. Out here, many times the horses are kept in the sand paddocks.
mm,
There is likelihood of the horses when they are living on the sand,
mm-hmm.
while eating, they are picking up sand inadvertently, or
Yeah.
sometimes because of the less grass offered to
Yeah.
them. So over a period of time, the sand buildup happens mostly in the large colon, and that too in the large ventral colon, because it is sitting downside. And with the gravity, the sand is coming on from the dorsal colon to the ventral colon, and it's accumulating there over a period of time, slowly,
It
slowly.
doesn't get passed out.
It doesn't pass down because the horse
Right.
keeps consuming. There is nothing else for the sand to move it from there, because it is just sitting on the ground surface, like it sits on the ground
Yeah. Yeah.
here. And the feed material what we are providing to the horses is not a material which can take the sand out with them.
Right.
So over a period of time, when the sand accumulation increases,
Mm-hmm.
it is going to uh, disturb gastric motility,
Mm-hmm.
causes the displacement of the large colon,
Oh.
and pockets of gases
Mm-hmm.
with impaction of the sand.
Right.
So everything together.
Right.
But the primary factor is the sand, which contributed to the secondary causes of the large colon displacement,
Right. Right. Right.
and impaction, obviously, because of the sand. So when you diagnose, sand impaction can be diagnosed with the X-rays also,
Okay.
because is
Physical.
very radio opaque material.
Oh, I
So
see. Okay.
when you take an X-ray,
Uh-huh.
you will see a nice sand buildup in the large
Sand
colon.
dunes inside the stomach.
Yeah, in the colon.
Right. Right.
Uh, what you have to do for sands is you can give paraffin oil, but it is better to give psyllium husk. Psyllium husk is basically a very hygroscopic material with the surfactant
Yeah.
action,
Uh-huh.
and that will kind of stick the sand to its outer surfaces and try to move it
Yes.
slowly, 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 slowly,
Yeah.
and eventually it will start coming out with the manure as the motility comes down.
Okay.
And you can do the X-ray just to see how much it has reduced. If
Mm.
you've been able to see first time with the X-ray how much it was and how much it is now, so that will kind of give you an idea. What you can do is, if somebody's horses are on the sand,
Uh-huh.
most of the time they can use on and off the psyllium husk products. There are a
In,
lot of products readily available out here:
yeah. Yeah.
Sandex, Clear Gut,
Yeah.
and the pellets of psyllium husk,
Yes.
uh, like 1 week yes, 1 week no, kind of.
Right.
Just to remove the sand buildup slowly, slowly, so a horse doesn't go into this kind of colic,
Problem to start with.
uh, result into a bad impaction colic of the sand.
So this sand impaction is mainly for desert stables where the horses are physically on sand, or does it happen with normal stables as well? Normal
No,
stables.
it is basically with the horses who are stationed or who are standing on the sand most of the time, because
Right.
horses basically grazes, and while
Yes.
eating, they eat from the
Yeah.
net. Most of the people provide nets, the grass in the net,
Yes.
but
Yes.
eating, much of the grass falls down on the ground, and invariably they will eat from the ground as well.
Yeah. Yeah.
So a small amount of sand is invariably going into their gastrointestinal system.
Right. Right.
Over
Right.
a period of time, that is going to build up.
Right.
If somehow the people who are handling the horses or offering the grass doesn't uh, understand that the horse is having less grass,
Mm.
so at times they can eat sand, not voraciously, but to some extent, which can again accumulate and give
Right.
you the cause of the impaction.
It sounds like they have to have a proper feeding schedule, going back to the original this thing, that they need to understand how much to feed, what to feed,
Exactly.
and how to
That's very
balance these
important.
things.
See, as far as any types of colics are concerned,
Hmm.
prevention is the best treatment.
Hmm.
So you have to have a proper dietary management, followed by a rigorous follow-up as
Yeah.
to what the horses are doing,
Yeah.
keeping an eye. Anything which is looking different from the normal, you should be able to catch and then try to find out what's wrong with the horse.
What's
That gives you a broader idea as to uh, what's happening with the horse if you are trying to diagnose,
hmm.
and then you can treat it earlier, causing earlier resolution of the problem.
Makes
That's
sense.
how it works. The late you are, the
Bigger
more bigger the
problem.
problem becomes.
Makes complete sense. What about, can you talk about a case that you have remembered, a memorable colic case? Okay, this is not a very bright idea, but anyways, a memorable case that you remember because, it's successfully solved or didn't solve, whatever it is.
Yeah, I mean, I've been fortunate to encounter many colic cases throughout my career.
Yeah.
Some were medically, some were surgical.
Mm-hmm.
I would mention you two cases out here. One was medical and one was surgical. First, we'll go with the medical case.
Uh-huh.
So this horse comes to us like not eating, pain symptoms and all and all.
Mm.
So I did the whole workup.
Yeah.
What I do, as I told you, clinical
Yes.
examination, conditions and everything. I did rectal examination. Um, I diagnosed with the impaction colic of the cecum.
Okay.
Cecum is sitting on the right side, right upper side of the
Mm-hmm.
quadrant of. So I know that we followed it up with the ultrasound scanning, where we can
Mm-hmm.
see and the feed material,
Mm-hmm.
hyper material. So we started treating this horse with DOSS. DOSS is basically something like psyllium husk. It
Okay.
is dimethyl sodium sulfosuccinate.
Right.
It is a surfactant, a soapy material.
Right. Okay.
So we gave it into the mixed with the water. We gave it with the tube.
Okay.
So what we have to do is just one point I want to mention. Whenever you do a tube in the horse, you have to see if the gastric reflux is coming, to
Yes.
see
Yes.
if
Yes.
there is a stomach buildup.
Yes.
It is
Yes.
very a good thing to do with the horses, especially because
Yes.
if the gastric buildup is more, again it is causing more pressures onto the
Yes.
organs behind the
Yes.
colon. So you pass on the DOSS. Coming on to the DOSS, you pass on. I passed on the DOSS. I'm
Mm-hmm.
waiting for it to act, but it was
Yeah.
not acting that much because the impaction material was very hard.
Right.
We
Okay.
were concurrently following with the fluids, analgesics, and all and all.
Mm.
Um, Followed up with the anti-endotoxemic dose of flunixine because the lower case goes on.
Mm.
There are a lot of chances of setting in endotoxemia and
Mm.
causing secondary problems in the hospital like diarrhea
Mm. Mm.
or arthritis.
Mm.
And so we were trying that with various stuffs. We gave charcoal or material of charcoal,
Yes.
which is
Yes.
endotoxin binder
Yes.
mixed with the water
Yeah.
and the endotoxins. So we were doing this variety of stuff. We asked the own trainer for
Mm.
the surgery because the horse was not responding the way he should.
Yeah.
With the owner's I think permission, trainer declined because they didn't want it to operate the horse.
Okay.
So we were doing these things over and over again for
Mm.
days. And on the seventh day, the horses started responding. And
Huh.
by the 10th day, the horse fully recovered.
Wow.
And we had piles of manure, uh, which we accumulated, just to see.
Yeah.
And I was very happy, man, on the ninth day.
Wow.
Because eventually, we got out of that impaction colic. So
But that's a big
one case
thing.
which I remember because of the long tenure of the case. I had variety of cases for
Hmm.
that matter.
But
And there's
one of the
yeah,
things, sorry, I was going to interrupt you here, is one of the things that seems to have come out is patience. You require patience. If you're going on a line of treatment, you cannot expect overnight results. Sometimes it requires persistence, follow up, consistency of treatment. Whereas I think one of the things that happens in, especially here, is if something doesn't work, change it. If something doesn't work, change it. That patience component, I guess, is also very important when it comes to
yeah,
maybe
true,
everything that you deal with.
true. I would say with animals, when you are treating as a medico, any
Hmm.
sort of animals, whether small animals, large animals, basically even in humans for that matter,
Hmm.
it
Hmm.
goes same. You need something called as perseverance.
Yeah.
Like you need to keep following with whatever is thrown at you, with whatever is available to
Yeah.
you
Yeah.
to do it.
Yeah.
Because if the owner doesn't want to do the surgery, you don't have any other option. You have to follow by it.
Absolutely.
And then there you need a constant follow up of the treatment, maybe a change of the
Yes.
treatment by following up how the horse is proceeding in a good
Yes.
direction or in a bad direction, and
Yes.
communication with the trainer or owner.
Yeah.
But what's important is the perseverance to go through the whole thing.
Yes. Yes.
The end result may be good or bad,
Yeah.
depending on the decisions taken by us or by the trainer or a owner,
Yeah. Yeah.
because we can't overwhelm the decisions made by the trainers and the owners
Yes.
uh, as a mentor.
Yes.
So what helps us throughout is perseverance.
Yeah.
You continuously follow it up, back it up with your findings, and modify the treatments if needed
Yeah.
with
Yeah.
whatever tests you have done, whatever results you have,
Yes.
and
Yes.
clinically correlating the horse, how it is going. That's very important. And,
Makes sense.
uh, most of the times, if you get a good backup, which many of the medicos get in
Hmm.
humans and in animals,
Hmm.
you get good results. Sometimes invariably the results don't go in your favor, but that applies to the whole of the medical science.
Right.
That is inevitable. Some things are not really in our hand, or sometimes by the time we get the case in hand, it is already too late
Too
to
late.
do so. You know,
Too late.
so it depends on how
Makes complete sense.
yeah you get.
Sorry, I interrupted you. You were talking about the surgical intervention.
Yeah. So the another case was of the surgery wherein we diagnosed that the horse is having a small intestinal strangulation because
Okay.
we could feel it on the rectal examination.
Mm-hmm.
Followed by the sonography, we could see some of the motile loops and many
Mm-hmm.
of non-motile loops,
Mm-hmm.
about 4.5 5 centimeter in size,
Mm-hmm.
diameter. The horse was continuously in pain, not
Mm-hmm.
responding to the analgesics as well.
Mm-hmm.
So we waited for a few hours down the line
Yeah.
with the treatments and all, medical treatments basically, fluids, analgesics, sedatives,
Yeah.
gas
Yeah.
decompression of horse, um, followed by antibiotics. Uh, just to mention here why antibiotics are important, because if the horses go into colics in a longer duration, it is always better to give antibiotics because non-beneficial bacteria try to proliferate in the gut and
Right.
produce
Right.
lot of gas and endotoxins. So to
Right.
prevent their growth of anaerobic bacteria and non-beneficial bacteria in the gut,
Mm-hmm.
it is better to start with the antibiotic if the horses are going into longer duration of the colic. So we
Right.
try to do it after 3 4 hours
Right.
just
Right.
to help the horse. Um, so yeah, and again, when we diagnosed that, I went to the trainer. I told
Mm-hmm.
him my findings, that this is this, how you want to
Mm-hmm.
proceed. Most probably in strangulated colics, if the horse is very painful and not responding,
Yeah.
it means that there is a proper knot of the small intestine,
Oh, wow. Okay. Yeah.
abnormality.
Spun and twisted. Yes. Yes.
And in major sense, with my experience, it doesn't revolve spontaneously.
Right.
It needs an intervention.
Right.
So the trainer agreed,
Mm-hmm.
fortunately, and then we opened the horse. There was a volvulus of the small intestine. The moment
Mm-hmm.
you open the abdomen, you see a lot of small intestines, um, like lotus-like structure, big. You could feel them. That's not normal for the horses to have because a normal small intestine is very smooth and a moving structure and very small. It is
Yeah.
not a engorged
Yeah.
structure
Yeah.
with a gas and fluid filled.
Mm.
In addition, he also had ileocecal valve displacement. Basically, what happens is small intestine attaches to the cecum,
Mm.
which is the first starting point of the large colon.
Mm-hmm.
So there is a small opening called as ileocecal valve from
Mm-hmm.
ileum, from the valve you are opening into the cecum.
Mm-hmm.
Something called as colic junction. From
Right.
cecum, there is one valve which is entering into the colon.
Right.
So that ileocecal valve was compromised, was kind of distorted because of the whole strangulation of the small intestine and
Uh-huh.
change the position of the cecum.
It's very
So
complicated. Sounds and it sounds like when you opened, you saw, it's too many things in your hand.
yeah, I mean you have to go gradually. It
Yeah.
is it is not that you by then we knew the moment I
Mm.
opened that it is a strangulation. So
Mm.
you try to see where the strangulation is and try to destrangulate
Right.
by feeling in which direction the strangulation has happened.
Yes.
So
Yes.
in reverse direction, you try to destrangulate.
Mm.
First, what you can do is you decompress the small intestine. You
Mm-hmm.
try to the gas so that the volume of the intestine is less and it is easy to manipulate or maneuver the small intestine.
Yeah. Yeah.
While you are maneuvering, you have to use a lot of lubrication because intestine is lubricated because of the
Yeah.
peritoneal. So you try to do a minimal damage to the intestine.
Mm. Mm.
Plus, when you do this, you try to follow it up closely. How
Yes.
you see them anatomically, how it sits in the abdomen in a
Yes.
normal position anatomically, and you just try to check the position. And wherever you feel abnormality, you try to correct it.
Right.
And
Right.
everything you put in position and make sure that everything is in position. And then
Mm.
you take up the horse.
Wow.
So it feels easy to tell, but it's a lot more difficult when you are doing it because you are trying to do it in a kind of small incision.
Yes.
Not small, but optical incision.
Yeah.
Uh, the big organs, horses' organs are very big, and when the horses
It's the size weight of the
surgically,
horse is so big. I
yeah, having
understand.
a surgical colic with the gas and a fluid buildup, and the colon content in it. The
Mm.
colons, when they are filled, they are
Mm.
massively big, massively big.
Okay.
So it is very difficult to handle them because of
Mm.
the less blood supply to them. They become very fragile
Right.
because of the lots of content in them. So it is very difficult to retrieve the parts of colon
Right.
to
Right.
put them into the colon tray, handle them.
Yes.
So it becomes a very tricky involvement or handling. So
Right.
you have to do it nicely, but kind of taking optimal time because you cannot lose time basically when the surgery is happening.
Yes.
Then if you are using more time, things can go against you or against the horse.
Correct.
Uh, so you try to do it in as short time as possible. All of this procedure, whatever you are trying to perform.
Makes
So
sense.
finally, we performed the procedure and we did some post-op on him, like gastric decompression for a day or two when he was
Can
getting.
I interrupt you here? How long was the surgery?
The surgery took 2 hours 15 minutes.
Right. Okay. So not a
So it was
short.
not very less time also, but it was not yeah kind
Tricky.
of optimum I would say. Anything close to 2 hours 15 minutes, 2.5 hours.
Fair enough.
Anything above 3 hours, you have to still think that you know what's going on. It can happen. I'm not saying it cannot happen. It can happen, especially with
Mhm.
the colleagues which are bad and where you
Mm.
cannot diagnose.
Right.
It happened with one of my colleague, senior colleague, I would say. That was the first case of epiploic foramen entrapment, which
Right.
we saw and which
Yeah.
he saw in his lifetime.
Right.
He has worked more than me. and he couldn't find out which way the small intestine has passed in, how to retrieve it.
Wow.
So there was a lot of struggle in retrieving because we didn't knew from which side it
Mhm.
had proceeded, how to remove it, because
Mm.
it was whatever we were doing, it was not helping us.
Yes.
Even the
Yes.
retrieval, it was kind
Yes.
of stuck. So in this kind of cases, you can go against the time.
Mm.
Uh, that can happen. Things can go differently than what you have desired them for or what you're thinking for.
Right.
So these are the reality checks and the practical difficulties of dealing
Surgery.
with it, and surgeries as well. So
Going
after
back to your case.
this horse got okay.
Yeah.
The concurrent problem what he had was he was diagnosed with hind limb lameness. I diagnosed him with the tibial stress fracture bilaterally. He got a
Oh,
stress fracture in the tibia on
okay.
both.
Okay.
So he got into rest, some more rest.
Okay.
But in his first race, when he raced his first race after colic surgery,
Yeah.
he won.
Oh, wow.
And I was so happy, and even the trainer was so happy
I can
that
imagine.
yeah, we took the photograph together with the trainer, myself, the trainer, and the horse. Uh,
Mm.
it was really a joy for me to help the horse, basically, for the horse to win in his first outing.
Right. Right.
That's
I
how I remember the case, because how he won in his first outing. So
exactly.
these are the cases. Yeah.
That is where, it's all worth it. Everything is
Yeah,
worth it.
really,
Once you see
really.
the success on
Where-
the
where-
track, race course, or wherever whatever sport the horse is in. Can you talk a little bit about your journey and how you came to the UAE and to your current stable? Could you tell us a little bit about yourself?
Yes. See, I started equine medicine in year 2009.
Mm-hmm.
I was working at the race course
Mm-hmm.
there many years. I left the race course as a deputy chief veterinary hospital in charge.
Right.
I came here 2015 and I came here, and since then I'm working here with these animals out here in the stable.
Yeah.
Out there, I have thoroughbred racing horses. Out
Mm-hmm.
there, I have endurance horses.
Right.
So it's a little bit different in the sense that the racing is different.
Mm-hmm.
Again, I'm working with the racing horses, which are again athletic horses, and they're
Yes.
racing
Yes.
required to be kept in top of the fitness uh, to be better athletes. Not
Mm-hmm.
so. Yeah, this is my journey out here. I have done my graduation from the Bombay Veterinary College. It was a Bombay Veterinary College back then. Now, and I was fortunate to pursue my residency in surgery and radiology in the
Right.
same college
Right.
because there's a lot of demand for surgery.
Mm.
Back then also, and it is more even now. Now it is even more. So I pursued my residency in surgery and radiology,
Mm-hmm.
and then I got into this because one of my friend got a job in a stud farm,
Okay.
very well-known stud farm. I will not name it here, but
Yeah.
very big, very well-known stud farm.
Uh,
And I always, since my childhood, I always liked horses as an animal. To be frank,
right. Right.
I was amazed with the horses, and
Right.
that kind of gave me uh, more thirst to push me towards the horses, and I
Mm.
ended into the race course, uh, and then my journey started with the horses from there till today.
True, because very few people actually get into equine. It's a lot easier to talk about dogs, cats, goats, that sort of thing. But you hear less of people that have focused their attention into the equine field.
Yeah, for India, I could say that because first of all, the number of active racing uh, race courses
Mm.
are having some sort of problems. So the thoroughbred population is reducing
Yes.
over the years
Mm.
gradually. And again, it's a very you know kind of sports limited to people who have entered into it.
Yes.
The
Yes.
thought process of vets for horses is it is a very expensive animals. Even though you try to treat a horse with some owner in a outskirts or suburban area or village,
Mm.
there is not much exposure in the vet schools first of all. So
Yeah.
the knowledge is limited. Plus,
Yes.
you have a fear if something goes wrong, the things might cascade into something else.
Mm.
So all these things make sure that you don't get into horses that much.
Mm.
But vet school doesn't have that much of exposure to the students for the
Mm.
horses.
Yes.
That again increases the chances of not going into entering into the equine field.
Yes. Yes. Yes.
If
Yes.
the students get more and more exposure to the horses,
Yes.
basically their interest will increase.
Yes.
It will open a new horizon as to what they will try to perceive more.
Yeah.
Uh, because even though somebody likes horse as an animal more, it doesn't mean that he will try to pursue the equine medicine just because of the liking.
Yeah.
Because he is not having the more knowledge about the horse as to how the
Yes.
field works
Yes.
and how far he could reach.
Yeah.
What are the good things about the profession? What are the
Yeah.
disadvantages of the practice?
Yeah.
The overall idea they will not get it.
Yes.
So they will get this idea only when they have some sort of experience with the horses.
Mm.
Fortunately, the vet schools in India are lacking into that. So that is a profound reason for students not to pursue this and to pursue small animal practice. If you compare the large animal vets, at
Yes.
least in
Yes.
India, compared to small animal vets, there are way more small animal vets as compared to large animal vets, and way less large equine vets compared to small animal vets.
Absolutely. It's a growing field, and it will slowly get there with
Yes,
exposure.
but nowadays there is a lot of equine vet population increasing doing private practice because the private horses ownership is increasing in India now. These
Okay.
Marwari horses, Kathiawadi horses, now they are
Uh-huh.
becoming as, an icon nowadays for the owners. They are
Okay.
buying what crores of rupees of horses because of the passion they are
And who-
having, or for show jumpers, or for these melas they have, no, in India.
yes.
They're
Yes.
having
Yes.
melas for that purpose. So, what I'm knowing through my friends and all, the practice is going good, at least in
Local
private practice,
horses.
in the local houses, the
Local
private
horses.
practice.
In ethnic Indian horses.
Yes, that
Oh,
is there.
yeah. And they're supposed to be beautiful horses. I've never seen one. I've never seen a Marwadi horse or a Kathiawadi horse, but they're
No,
supposed
no.
to be stunning
Yeah, they're
to look
very
at. The
like, yeah, Marwari horses are very beautiful, like Arab horses.
okay.
Uh, the ears they are not as tall as some of them are, but
Mm-hmm.
average height is little less than Arab horses or thoroughbred horses.
Mm-hmm.
Thoroughbred horses are nicely tall, but they are having a very nice compact structures with their ears twisting back, increasing their beauty.
It's
And very robust horses. They are not very speed oriented horses,
mm,
but you can go in a previous times, olden days, people used to ride on these horses on a constant speed
yes.
during the nights
Yes.
altogether. You
Yes.
know, so they have a very good stamina. These horses,
Right.
same with Arab horses, they have very good stamina. So in endurance, a mix of Anglo-Arab is used, which are having good heart and a good stamina for the
Yes.
races. So
No, it
we are
sounds
beautiful horses.
maybe we will see a revolution on that side rather than this side. Rather than the thoroughbred side, we'll see a bigger revolution on the other ethnic Indian side.
No, I
Um,
think for horses, as it is, at least India, because the domestic Indian horses, at least people are interested.
yes.
Because are happening more. The competitions are happening way more.
Yeah.
Uh, Recently, some of the people are organizing endurance races in India,
Okay.
40-meter endurance race and all. I have heard 3 times at least they have organized
Okay.
near Gurgaon area, close to Pune vicinity.
Okay.
Got some videos and photos of that. few years back. So at least something is happening on that front. So at least people get into it, and when the interest is increasing,
Yes,
then the breeding will increase, and then the population will increase
absolutely.
eventually.
Yes.
Um,
It will endure. Somewhere it will endure. It might not be in the one that we imagine, which is, thoroughbred horse racing. Maybe it will increase in endurance when it comes to Marwadi horses or Kathiawadi horses, or horse beauty shows or whatever. It can go in
yeah,
various directions as long as the population overall goes up. Our objective is achieved.
yeah, I think so. As long as the people are having interests of their own for racing or dressage, show jumping,
Mm,
or just to have animal as for compassion or joyride,
mm,
that's good with the profession. Everybody prospers, including horses, who is the
yes.
basic performer or basic core of this.
The last question I have for you: what or who inspires you?
Well, there are many people, to be frank,
Okay.
but I would like to tell you about one person out here
Mm-hmm.
since many years. Is His Highness Sheikh Mohammed bin Rashid Al Maktoum. Because I've read and I've seen a lot of photographs of Dubai
Mm-hmm.
25 years back, not like 20, 50 years like your father. Even back then, I could see one or two buildings, even in Sabil area and all, and
Yeah.
roads and mountains of sand,
Yes.
and nothing much, to be frank.
True.
From there to what I've seen 9 or 10 years back,
Mm-hmm.
till today, the transformation of the emirate,
Mm.
uh, name it, everything, digital technology, hospitality, real estate, um, the number of nationalities which are living in, the businesses which are thriving left, right,
Mm-hmm.
center,
Mm-hmm.
uh, the whole country which has progressed under the leadership of
Yeah.
these leaders, which they had vision, courage, and wisdom for,
Yes.
is unimaginable.
Yes.
Like a small person, a common man, if he's try to go into business, there are hundreds of problems which he'll face.
Mm.
And a person of his stature,
Mm.
if when he's trying to lift up the whole emirate and the country,
Mm.
I'm sure he must have gone through millions of problems like that
Yes.
during the course of time.
Mm-hmm.
What I said earlier, perseverance plays the important role, and the
Yes.
conviction to do it. That
Absolutely.
eventually we will achieve it. We will not give up.
Absolutely.
That's immense.
Absolutely.
Name it, even the Emirates Airlines, one of the best among the leading
Absolutely.
airlines.
Absolutely.
So you name it, everything like which wasn't there before, and how it has come up.
Yes.
Um, a lot of Europeans, Americans, all the people, nationalities of 200 countries are here.
Yes. Yes.
It's because of inclusiveness, the businesses which are thriving, better remuneration. It's a mix of everything.
Absolutely.
So to
Absolutely.
achieve this level is remarkable,
True.
very
True.
commendable. Because of that, I admire him, and I am inspired from him. To be very frank, it's very very difficult to do this. It's
Absolutely
not
right.
at all a small feat, in my vision at least.
It's not. It's not. I guess His Highness also, one of the things that I have always admired is that the entire family is like that. They are visionaries. They think ahead, so far ahead that we cannot imagine. Um, I will give you an example of something I had heard many, many, many years ago, and now we are going little off topic again, but I will talk about it. His Highness's father, Sheikh Rashid, who was the ruler of Dubai before Sheikh Mohammed, had a vision for building Jabalali port. And if you're going back at the time, there was no AI, no graphic design, no this thing to imagine what he was imagining, what he was thinking. And at that time, you only had sand dunes. You really
True,
had sand
true,
dunes in
true.
his time. But he went to the UN, I think IMF, if I'm not mistaken, to ask for a loan. And he was so expressive in his vision that was granted. And one of the things that he described is Jabalali Port will be the only port in the world which is visible from the moon. And that is true even today. If I'm not mistaken, now maybe there might be other ports. But at that time, he was the only visionary who said that it should be so, it should stand out so much that it should be visible from the moon. And that is the case. Today, we don't realize. And when we look at Jebel Ali, we are like so used to seeing that this port exists. But at that time, when he imagined it, 50 years ago, 60 years ago, maybe more. At that time, it was only sand dune, and the seashore.
Yeah.
That visionary quality has been in the family, and that has taken Dubai or this country to a next level altogether.
No, I agree with you. All the family members are very visionary.
Absolutely.
Not for that matter, not only in Dubai, Abu Dhabi royal family,
Absolutely.
and other royal families of all the Emirates, as they have come to, they have
Exactly.
incredible levels of human development,
Yes.
and still are going on the same path to achieve even more heights
Yes.
on the same path.
Absolutely.
They are very futuristic as well
Yes.
in their goals, what they have set up, and very ambitious goals they have set up. So it's not a ordinary man's job, I would say.
It's really commendable. Thank you so much, sir. It was an absolute pleasure talking to you. And I'm hoping we pick up another topic and come back again and talk to you again very soon.
We'll try to do that. Thank you very much for having me.